Hello, my name is Gallagher. I am a plastic and reconstructive surgeon, and in this video we're going to be talking about breast implant illness. So this is something that is coming up more and more. It tends to be in the news, and particularly we see it a lot on social media. So I just wanted to go through some of the bases of what we do and we don't know about it and help answer some of those questions. So breast implant illness, first of all, the official line would be it doesn't exist. So it's not a diagnosis that you can have your doctor make and your insurance will take care of you because it's an illness. So it's not officially a diagnosis. However, what we're seeing is a lot of patients, and particularly joined together on things like Facebook pages, complaining of a wide range of symptoms that they attribute to their breast implants. Now, sometimes these symptoms will be other diseases, like autoimmune diseases where the body attacks itself, such as lupus is a very common one, vitiligo, various forms of arthritis. So sometimes patients do have diagnoses like that, but more commonly what we see is patients with kind of more vague symptoms that they go to their doctor, they feel tired, commonly hair loss is another thing, aches and pains, sometimes sharp pains, and patients are pretty convinced that these symptoms only started since they had their breast implants in. So there's no blood test for breast implant illness, and so it's a very tricky thing because it's very hard to prove something doesn't exist. So one thing I will say, breast augmentation with implants is the most common cosmetic procedure done in the United States every year. So it's extremely common. About 300,000 women or more undergo this procedure every year, and it's estimated that probably somewhere around 5% of the American female population have breast implants. And of course, in my practice, we do it a lot. We do this for breast reconstruction, we put implants in, and also for cosmesis and also for gender affirmation as well. So we certainly do treat a lot of patients, and the vast majority of patients don't have any issues. So this was looked into once before, back in 1991 or 92. Actually, there were some concerns, and briefly silicone implants actually went off the market to investigate this. Back then, the FDA didn't find any proof that there was an illness specifically related to implants, so the implants came back, the silicone implants came back onto the market again. So that's what breast implant illness is. It's still a little bit vague. There are a lot of women who are convinced that their symptoms are related to their breast implants and will oftentimes seek to get these out. Unfortunately, right now, because breast implant illness is not a recognized disease, it's very difficult, if not impossible, to get your insurance to pay to have your breast implants removed. The exception would be if your implant is found to be ruptured, but otherwise it can be very tricky, and oftentimes patients will pay to have their implants removed. And we'll talk in another video a little bit more about what that might look like.